In one word, I would say the situation regarding antimicrobial resistance, especially in the field of neonatal sepsis, is grim.
Believe me, antimicrobial resistance is the new monster in healthcare.
In India, we are in a pathetic state because we have not, and though we are part of WHO GLAS, we are part of a global action plan, but the national action plan and the various state action plans have not taken shape.
This, of course, action has to be taken locally, but it has to be a global collaborative effort if we really want to take care of antimicrobial resistance.
If you look at healthcare costs, they are going through the roof, and one of the major undermining factors for this is antimicrobial resistance.
There is lack of collaborations, there are lack of integration, there is lack of funding, there is lack of trained manpower.
AMR is indeed a global problem affecting millions of people with a high mortality. And CAMO-Net is a collaboration of researchers from Asia, Africa, Latin America, and Europe. And the important thing about this network is that the research is happening where people are affected the most.
Context is the bottom line of all the activities that we do for optimized use of antimicrobials. And unless and until we understand very myriad shades of context in settings like ours, where we have both very well evolved systems, and on the other hand we have systems which are not so well evolved, we will not be able to give tailored solutions, and it's the tailored solutions which will lead to the solution of the problem.
My colleagues and I from Wellcome are joining researchers from 4 continents who are coming together to address one of the priority health challenges we are facing today, the global AMR crisis.
Yeah, so you see, microbes don't know about borders. They spread across borders, and the other thing that does not restrict itself to borders is the understanding and science.
This is something that the CAMO-Net collaboration is addressing, and for us it's important that the research is happening where people are affected the most.
And I think antimicrobial resistance is probably one of the biggest, single biggest global threats to humanity at present.
That is something that we need to prevent, and that knowledge has to be disseminated all over so that we can empower our physicians and we can empower our patients to be healthy and get treated.
CAMO-Net is so very well thought through because it brings in optimization of our prescription practices.
A unique feature of the CAMO-Net collaboration, and this is important for Wellcome, is that we are funding the sites in low and middle income countries directly. And this creates a great sense of ownership and accountability, and the research is driven by the scientists from those countries.
So I think in totality, what we are going to do is something which is enormous, which has not been thought through, create collaborations, create a lot of integration, create a lot of networked learning from other sites, and doing something which has not been done so far.
And when you have such an understanding, the solutions that you would perhaps come up with would be more fruitful. And so I think CAMO-Net is a brilliant idea, and there should be more ways to strengthen it further.